All right. Then it goes top to bottom again. So you grab the first thing in here, which is your little sterile fill here. All right, you're going to now set up your sterile fill. You guys, if you ever touch your box, don't touch the edges, touch the bottom. You can move it with the bottom, okay? Then I'm going to grab my gloves. I'm going to put my sterile gloves on. You guys will want to do hand hygiene in between this, which means you're going to just use the hand sanitizer. Most rooms have them in there. Just do that before you put these gloves on. Okay. Okay. All right, so now, wow, I am far away. Let me get closer. Okay. So then what you're going to do is you're just going to kind of take all of the sterile stuff and put it on your sterile field here. Here's a little dressing change tag that you can. I'll show you what we're going to do with that here in a second. Here is a little thing to measure if you guys want to measure it, but we already measured it with the tape measure. Okay, and there should be a bunch of 4x4s in there. So what I'm going to do is I'm going to take, you have a sterile saline. I'm going to take these 4x4s and I'm going to hold a couple of them out, like maybe 2 of them out, and I will leave in this dry basin right here. Then I'm going to take the rest of the 4x4s and I'm going to put over here in this little basin. I'm going to open my NS, my sterile saline, and I'm going to dump that right over the rest of those 4x4s and saturate them with the saline, okay? Okay, then I'm going to take the saline and I'm going to squeeze the excess out, so then they just become damp. You don't want them saturated. Then you're just going to set them in this basin, kind of pull them apart a little bit so that you can just grab them. All right. Okay. Okay, now, Mr. Jones, we're going to go ahead, or Mr. Jones, Mrs. Jones, we're going to go ahead and start cleaning that out. So you're going to clean from least contaminated to most contaminated. Least contaminated is considered the wound itself. Most contaminated is the edge and around the wound. So you're going to take your finger and put it kind of in the middle of the 4x4, and you're going to go straight down, not touching the sides, straight down the center of the wound, like that. Then you're going to throw your gauze in the garbage. Then you go to the next one. Same thing. Fold it in half. Put your finger down right in the center so it curls around it and you're not getting this contaminated. Then you go down the side, the right side, throw that in the garbage, making sure that you don't touch the skin. The last part you're going to clean is on the left side, down the center. Okay, now we're going to go ahead and pack that a little. You may feel a little bit of pressure. If they have any tunneling or any areas like that, you need to lightly pack that with the moist gauze, okay? Once again, you need to try and not touch the skin. And you also don't want to have these gauze pads sticking out over the edge because they're wet, and what the wet will do is soften that skin, like that maceration that we talked about. You don't want the skin wet, just the wound itself. Okay, so you're going to kind of push that in just lightly. You're not going to push it in heavy. And don't touch the edges. Okay, then you're going to do, so that's the wet part. Now you're going to do the dry part, which is you take these two 4x4s and you set it right over the top of that. Then you take what's called, this is an ABD pad or abdominal pad. You're going to put this right over the top of that. Okay, now the sterile part is over. You don't need to be sterile after that. Okay, so what we're going to do is we're going to take the tape and you are going to tape along all the edges of the dressing, making sure that it's nice and secure. Yeah, and sometimes you will get down to the pubic area, and if there's hair, shave the hair just to be nice, because that's really mean. Okay, so then you're going to tape that all really good. Then you're going to take your, I'm going to at this point take my gloves off, okay, and I'm going to take my pen and I'm going to label the dressing change, the date, the time, and my initials, and I'm going to put that label right there. If there's not a label in your kit, then you could just write on the corner of one of the dressings or on the tape the time, your initials, and the date that you did the dressing change, okay? Okay, so after I have done that, then I dispose my equipment, throw everything away, and do some hand hygiene. Then I'm going to cover my patient back up, get my patient comfortable, ask her how she tolerated it, if she's okay, if that pain medication we gave her is still working. You're going to chart any untoward effects, any changes, any problems. Did it bleed when you cleaned it? Was there more exudate? Was there odor? You know, the size, the length of the wound. You're going to ensure her safety. We'll put her bed back down, pull her side rails up, and then put her call light in place, and then she can just call us if there's any other problems or whatever. Then you're going to watch that dressing and make sure that it doesn't seep or, you know, those types of things. So that's how you do a dressing change, wet to dry.